Yeah. Hello, everybody. Thank you so much, Governor. Thank you, GM, and the roundtable members for inviting me and for having me here today. It's a wonderful opportunity to meet longtime friends and colleagues and to make new friends as well. And I really appreciate the Governor's words on the human tragedies that we are seeing now in Houston and in Florida. They are a strong reminder that lack of urban planning, proper urban planning, will make lives much worse with any tragedy that will be happening. But also it's a strong reminder of how built environments are interconnected with human lives. And in built environments, when they are properly designed or when they are disrupted, they will affect largely people that can't afford to thrive in life without proper resources. So I think we are seeing human tragedies that we are seeing now. They are reminding us how important it is to know where and how to build things and to make society a better place for everybody. Oh, I think this is the wrong slides. I have to go up to the first slides. If I can't ask somebody to help me. Thank you. And now you have seen all the presentation. So I can just sit down and wait for questions. Thank you so much. So I will share some of our perspectives from the international works that we have done with other colleagues, and some of the national perspectives we are seeing now from the early results that we are, from a few projects that we are doing now. So I think we all already heard about the tremendous impact that human lives are facing now due to lack of urban planning or how cities have been designed. So I don't have to highlight all those outcomes, but we want to call you the attention on how we can connect those health outcomes to urban planning, city design, and social policies. It's also important to understand, although this is somehow in an emerging field, as Jim highlighted on his talk, it's getting fast and steady attention worldwide. So everybody now talks about how cities are important to improve lives. And just to highlight, 6 goals and 14 targets for the UN Sustainable Development Goals are connected to urban planning or design. So designing cities is becoming part of the major approaches to improve people's lives everywhere. So with that in mind, we work together, 30 or some international colleagues. We worked together for 2.5 years, and we put a series of papers that were released last year at The Lancet. And in those papers, we tried to come up with a comprehensive framework about urban planning, urban design, and health. Some solutions that can be applied internationally from different parts of the world as well. And I will present you the framework that we developed. So our framework was designed to provide a series of interventions that we can implement in cities at different levels. So if you think at the regional planning can be improved by changing how accessible places are for people and how employment is distributed in the population, in the cities, and also how can we control demand management. So how can people use, or if they are more willing to use public transportation, for instance, or cars. So those interventions, they are really connected at a regional level of planning. At the local level of planning, we're talking about design, density, distance to transit, diversity, and desirability. Concepts that Jim already highlighted in his initial talk. So we think those 8 constructs are really important for us to improve city design and city planning. But most important, those concepts cannot be implemented without proper governance. So we found examples in the world, and including here in cities in the US, that when governance structure is well established, it's somehow easier to implement those changes. And we talk about proper governance. it is essential talking about proper governance because somebody needs to pay for those changes. Somebody needs to invest time and money and political will to make those changes. So proper accountability is super important, but also community participation is essential. So designing places is not only about money, but also about listening to people, about their needs and how things could be changed. But also it's super important to talk about equity and inclusion. As we are seeing now, as I mentioned before, people that suffer more from disruption on built environments in any place in the world are people that cannot afford to have access to health. To make those changes, it's really important to understand this is not only a health concern. This is not only a concern that belongs to the health sector. And that's, for me, it's the main message that we have from the series. When we talk about designing places, designing cities, or planning for cities, we are not talking about only planning for health. We are talking about different sectors that need to coordinate the planning process, and they need to work together. So we need more integration between sectors and across sectors. And we are highlighting the main sectors that we think that should be coordinating the actions. So we include the transportation sector, but also employment and economic development. Because if you don't know where jobs are and how to connect jobs to people, we will still not be able to make any changes. So social and health services and education, land use and urban design, housing, public open space, recreation, public safety. So we are advocating for those different sectors to coordinate the actions around planning and designing cities. So as you can see, we are not only talking about health, and this is the main message, I guess, we have. So if we coordinate those actions across those different sectors, we are more likely to make improvements in regional planning and local urban design as well. So why we need to do that? So we need coordinate actions and design better cities and plan for cities as well. So we can actually change transportation modes and daily outcomes as well. So in the framework that we developed, we address those boxes. First, providing employment and education access will be more likely to be the main need that you face when you have to design cities, and especially when we are talking with different sectors. I talked to Kevin a little earlier that I've been working with urban management, urban planning for a few years now, but obviously I'm not a planner or a designer. I'm coming from the public health training or background, but every time that we mention health with planners, they immediately disconnected from the discussion. And so I think you have to understand that different sectors have different priorities, but that doesn't mean that we cannot work together around those priorities, as long as we identify that those priorities are also connected to health outcomes. So for me, this is the main benefit for this framework. And this is one of the lessons that we learn in practice, but we are now able to conceptualize as well. So if we change cities, we can also affect preferences, attitudes, social norms, and especially demand. And we found out in many of the, especially public access to public transit and public transportation projects that I worked before, that public demand is the major driver for changes in public transportation. So if you don't change demand, it's going to be hard to change access to public transportation, because people have to advocate for needs and more affordable access to high-quality public transportation as well. And of course, here we are talking about cycling, walking, access to public transportation, private motor, and reducing use of private cars. So as you can see, we are not only talking about improving physical activity, we are not only talking about improving access to healthy choices, but we're talking about a more comprehensive approach to improve cities for everybody. So if we change those outcomes, we are able to reduce some of the risk exposures that we have. And we divided the risk exposures in this framework in environmental, social, and behavioral exposures. So we are aiming to reduce traffic, air pollution, noise, social isolation, improve personal safety, improve physical activity, reduce prolonged sitting, and improve access to health diets. But I think it's important to notice this. When we change traffic patterns, of course we have a direct health benefit. But we also reduce other things. We reduce air pollution, which has its own health benefits, but also are likely to affect other economic outcomes and social outcomes as well. If we change traffic, we are likely to reduce noise and to reduce social isolation. Because if people have more access to public transportation and high quality public transportation, they're more likely to reach out places and people as well. So they have more social support. So of course, this is connected to mental illness, but not only to mental illness, but with other health and social and economical outcomes. Eventually, improving physical activity, reducing sitting time, and improving diet will lead to better outcomes in obesity and cardiovascular diseases and so on. So we are all familiarized with that. But for me, I think it's important, that's my own take on this, to connect the usual suspects that we have when you talk about obesity. Sitting time, healthy diet, and physical activity, connect those most common suspects that we are blaming to other outcomes. Some people call them co-benefits, or some people call them side effects, because when they don't like those effects. So it depends on who we are talking to and what's the audience who is the audience that we are communicating. So we are seeing some indicators being applied in cities, and we are aiming with this framework to provide a set of indicators that we can use to monitor cities' progress around the world. Some cities are doing well using measures and using indicators. We have many examples in the world. In the US, quite a few examples. And the cities that are using those indicators well, they are more able to monitor their progress, but also to invest smartly and reduce cost of the investment and to monitor the progress and the cost effectiveness of those changes. So we are advocating to a better and sustainable use of indicators for urban planning related to health and to social outcomes as well. So we need to measure those things. So those city indicators include monitor legislations at local, regional, and national levels and international level as well. To monitor the investment that has been put at all levels, and planning and designing interventions that have been implemented, transportation outcomes, and the traditional health or risk outcomes that we are seeing. So many cities, they actually have been doing a lot of work in terms of monitoring the risk exposure, so physical inactivity or obesity, for instance, but they have poor tracking of the investment they are doing for urban planning or the actions they are doing for urban planning or for city design. So we need a more integrated approach to monitor progress as well. It's not only about monitoring health-related outcomes progress, but also about the city progress across the whole spectrum of outcomes as well. So we are advocating for 8 interventions, 8 indicators, and 8 city-related risk exposures. So, but also we might think, hey, so do you think this framework really works? And so a second paper in the series led by our colleague Mark Stevenson from Melbourne was actually asking, can we actually have any health impact if we make those changes? So Mark and his team, they led a modeling paper, and they asked this question: if we increase access, if we decrease distance, and you make cities denser, so if you make cities more compact, can we have any health-related positive outcome? So they model different, they use different models to implement, to assess whether those land use changes and transportation changes might impact cities. So they ran this model in different cities in the world. So we have 2 cities here in high-income countries that are really motorized. They don't have, people don't use much public transit there. Another city in London that the governor just mentioned, that you can walk and take buses and use a multimodal type of transportation. Copenhagen, which is also a more hybrid city, and 2 cities in developing countries that are more hybrid as well. They use public and then transit and private motorization modes of transportation. So if you examine the results that Mark and his team found in terms of the number of years that we lose, either by morbidity or mortality related to the main chronic diseases or cardiovascular diseases, respiratory diseases, road trauma, in those cities. So any city in the world it's been really affected by those urban planning or transportation related outcomes. So any city in the world is suffering for those bad or poor management or poor planning strategies. So, but the big question that we have, can we actually reverse these outcomes? Can we make changes if we improve those cities? So they model the changes by increasing a scenario with 30% increase in land use, diversity, reducing distance to public transportation by 30%, and shifting the mode of transport by 10%, so people will bike more and walk more. So this is just a scenario, which is not so difficult to imagine if you think so. So if we make cities more compact by providing more opportunities for people to walk, using public transit, and to bike, what are the outcomes that we see? So all cities that were examining these models, they actually found gains in terms of years with better quality of life or improved quality of life for cardiovascular disease, type 2 diabetes, some gains for respiratory diseases, but a reversed finding for road trauma, which is understandable because we can't just shift the mode of transportation without providing the proper infrastructure. So the model did not account for infrastructural changes. So if we ask everybody to just walk more and bike more, right now, of course, we have more road trauma, outcomes, higher road trauma, prevalences. So we have to invest in infrastructure. It's not only about, let's walk more or bike more. Let's prepare cities for people to be able to make the choices for them to walk or bike or use public transportation. So that's the big lesson from Mark's paper. So we have a really solid framework. The concepts that we developed, they are applicable, and we can see they are likely to produce results. But those results are highly dependent of changes that we need to make in built environments. But I think one of the lessons from the series is also we have potential solutions, we have a way forward, but how we make those changes, this is the big question that we have across the whole series and that I think we are discussing here today. And how can we engage people through all those changes in all those different sectors? So I'm asking now this question here across the whole United States in 5 different sectors. This is a work in progress, so we are seeing the early results that we finished just a few weeks ago. And we are asking planners, designers, traffic engineers, public health professionals, and parks and recreation professionals, both practitioners and researchers. How can we improve livability in US cities? And the results are really interesting. Of course, we have all different answers, but if you see the highlighted words, the biggest words, of course, you know how this graph works. So the bigger the word, the more frequencies we have. So they're more frequently cited. So if you ask transportation engineers, planners, designers, they never talk about health. I asked them, how can we improve livability? Almost nobody mentioned health. Of course, public health folks, they mention health, but not transportation engineers, not planners, not designers. But they all talked about community. They all talked about economic development. They all talk about support for systems or social support. So maybe you have to shift the message towards a more comprehensive approach in the way that we can messaging to the people that need to be engaged. So, not sure this is the best audience for me to advocate against health discourse, but I'm saying you have to, if the messaging that we are using now is not working, something needs to be changed. So maybe to engage different sectors, we have to messaging a little differently. Because when we talk about cities' needs, as we are seeing now in those tragedies that are happening, people are not talking about physical activity or obesity, but they are talking about housing. And you see housing mentioned there. They're talking about jobs. How can I open my store and work the next day? So those needs, they need to be addressed. They need to be considered when we talk about obesity, physical activity, and nutrition, and about improving health. Because if people can't actually live a decent life, if they can't have access to a thriving community and city, how can they actually overcome those barriers they need to make healthy choices? So this is one of the messages I want to give to you. And the last message, I think, was given by Jim Salis and his team a few years ago when they developed this comprehensive literature review. So they were asking about co-benefits. So if people know that physical activity is important, nutrition is important, obesity is a problem, so what about other things that we never talked about it? And other sectors really care about it. So they did a really comprehensive literature review examining what we call the co-benefits of built environment changes to improve physical activity. So Jim already mentioned the framework they used. They examined 5 different environments. But this is particularly important. They examine whether those changes in those environments will have any other co-benefits or side effects, depending on who you are talking about. And what they have found, it's really interesting. First, if you talking about open spaces, parks, trails, the summary they found is really interesting. The presence of parks and green areas and pocket parks has many benefits: physical, mental, social benefits, environmental benefits, safety benefits. So maybe when we talk with people from the safety sector, the traffic sector, other sectors beyond health, we don't have to mention health necessarily because they connect with the need for a park through other outcomes, through other co-benefits. Same thing when we talk about urban design, land use. We have a whole range of benefits, but we also have reversed results. We have negative results, which is now being showed in other recent papers published by the IPAN project. That, for instance, residential density is really good, but sometimes can be negative. We want cities to be dense, but not too much dense. It's not the more dense, the better the cities are. So smart designing, smart planning is important. It's not just the more you build, the more you increase access, the better the city is going to be. Transportation systems, mixed results, but also very important results for many stakeholders and policymakers. Environmental sustainability, social benefits, safety, and economic benefits. So when we talk about access to public transportation or biking or walking, we should not address only physical activity as the main outcome. Same thing for schools, but if you see the summary of the results across a whole range of co-benefits, it's really consistent. So my final thought, let's think about how we can message that. The work around urban planning, city design, and health in a more comprehensive and more effective approach with different sectors. Thank you so much.